Okay, good afternoon, everybody out in YouTube land. We are here with John Prucha, who is Triad Psych's clinician in our Carrollton office, where he works alongside John Mark Parker. And this is a getting to know you video. So people, if you're prospecting for clinical services or therapy, you can get a flavor here for how John practices and whether or not it's a fit for you. So welcome, John.
Thank you. Thank you for having me.
We're always glad to have you. We're going to talk now about your specialties, and I want to start by talking about our history in Carrollton, that it's a very interesting history. That our clinic, Triad Psych, our main office is in Marietta, and we have a specialization working with neurodiverse and TBI individuals, learning disabilities, anything involving neurology or neurobiology. So essentially, we had a contingent of patients who were coming in from Carrollton, Carroll County, Villa Rica, and it was a 90-minute drive each way. And unfortunately, especially for the kids, the drive was undoing any of the therapy we were doing. That it was very rare that it was a smooth ride. There was usually a lot of stop and go traffic because we're here in Atlanta dealing with 285 and the such. So a group of parents approached us and asked us if we could open in Carrollton. So we made the decision to do it. So it's very, we brought water to the desert. There was not any single specialty clinic dealing with neurodiversity issues in Carrollton until we got there. And we really love the community. John is the third clinician we've had in Carrollton. He resides in the area, which makes a big difference too. And John has a master's in clinical counseling from Liberty University, plus several certifications from the Amen Clinic, which is very renowned. He'll talk about that too, as well as being an Army veteran, honorably discharged Army veteran as well. So he also does a lot of work with veterans, and he has certifications in trauma, war trauma, a lot of things, but he'll talk about that now. So first and foremost, John, why'd you decide to become a therapist?
Well, Dave, again, thank you for having me today and bringing me in. And yeah, I decided to become a therapist because I realized that I had personal experiences throughout my life that I needed help putting into a coherent narrative.
Oh, wow.
And I needed help with that. I was entering into a new phase of my life from getting out of the military to becoming a dad, and I needed wise counsel. And so I sought it out. I'm a product of good counseling, and I wanted to give back.
I think so many mental health professionals got help from other therapists and decided to enter the field too. We looked at it and said, look, this looks pretty good. This is pretty fascinating.
Yeah.
A way to make a living, and a very satisfying way to make a living, because we're helping people.
Yeah.
It has its challenges too. So that being said, let's first talk about, you and I both work with traumatic brain injuries. We're the two specialists in the practice who do TBI work. Now, I approach TBI work from a special education point of view, because that's my other degree, and also an ADA, Americans with Disabilities Act perspective too, because I do expert witness work in that space. But tell me about how your training at Amen clinics and certifications you got from the military affect how you treat TBI, which again, traumatic brain injury, if anyone didn't know.
Yeah, excellent question. I should preface by saying I'm not a doctor, and I don't try and portray myself to be, but I did seek out during my schooling. I just became informed of that gut-brain relationship to trauma, and that a majority of veterans like myself, no one looked at the way the blood flowed through my brain. No one checked my brain at all. And I became curious about why that was, and saw that there's a relationship between the symptoms of PTSD and traumatic brain injury, but it's not showing up on the scans.
Right.
Like a CAT scan or MRI was coming back normal. But as someone who suffered just from TBI, I know something's wrong with my brain. And so seeking out the right help is crucial. And just found that psychiatrists and that focus on the endocrine system and the way that the blood flows through the brain and what areas of the brain are getting healthy activity is crucial, because just to getting back to daily functioning.
So does your therapy enable people to essentially light up or activate different regions of the brain?
I would say I don't know, just because there's no way. I haven't measured it by any means. I would love to know, but I can't answer that.
Well,
I don't know how to.
Well, then how does this training then help you if you're dealing with a TBI patient?
Okay. So Dr. Gordon from TBIHelpNow.org reached out to me in like 2014 or 2015 as I was starting my bachelor's, and I had never reached out to him. I don't know how he found me, but he reached out to me and sent me his book, Traumatic Brain Injury, A Clinical Approach to Diagnosis and Treatment. And he signed it, and it was basically an invitation to join the field and become a peer. And so I was like, okay, read the book and just became more informed on endocrine dysfunction, and that the symptoms a clinician like myself may be seeing, that there's a deeper root cause to the symptoms, such as depression, insomnia, fatigue, which are similar to the symptoms of PTSD. So I might be seeing something that a scan may pick up, or a functional psychiatrist or an integrative psychiatrist may pick up with a blood lab.
And when you say endocrine, you mean the chemicals in the body along with the bloodstream?
Yeah, the neuroendocrine function. So like all the glands, pituitary gland,
So the tie-in between the central nervous system.
Yes, the CNS.
And then the chemicals in the system too, and the bloodstream is very real. Chiropractors, I'm a big fan of chiropractic, and they got a bum rap for a very long time from neurologists, but they really, they're now branding themselves as functional neurologists. And I think it's fair and accurate that they can actually put their hands on your spine and other areas and remove blockages. And I find them to be really effective. And as someone who does a lot of trauma work, yeah, there is a massive mind-body connection that if we get to someone in the right amount of time after a traumatic incident, we can pretty darn nearly eliminate any chance of PTSD forming.
Yeah.
A lot of it, it's not just the talk therapy, it's about changing the chemicals in their system, that after a traumatic incident, there's a toxic amount of cortisol in the system.
Yes.
The question becomes, how do we clear it? Because cortisol is addictive. All PTSD is an addiction to cortisol, which is the stress hormone. So, ways to clear cortisol are critical in those envelopes.
Yeah.
Right. And from a special education point of view, we don't look much at the source of why something's happening. That if I'm working with someone who has a TBI, I'm looking at, there was a function you could do before the incident that now you can't. So how do I train you to compensate? How do I teach you a new skill so you can get that done again?
Yeah.
Where it comes from, not really a big part of the equation, more about how do we get you to the next level. So
out here in Carrollton, Dave, allow me to interject, is just we have a lot of sports is big out here. And so what my training has taught me is that, it's not just combat or explosions that cause traumatic brain injury, but soccer. I mean, how many times do soccer players hit their head with a soccer ball in practice? It's part of the body in soccer or football. Falls, just anything, and anything can cause these disruptions. So as a clinician, I may be seeing a parent or guardian bring their kid in for temper issues, but it may have nothing to do with, may have to do with something that I can't see as a clinician. So referring out to professionals that look at this stuff is crucial to me as a therapist.
But I think you bring up a good point that, you know, people come in for various issues, especially with kids. You know, why is my child having tantrums or meltdowns? And not enough clinicians, I think, are skilled to find out the true motivation for it. And we end up losing valuable time. The triad approach, the triad clinical approach, which everyone in our practice is trained in, and people still go on to carry out their own specialties, gets to the core of the issue right away. We determine motivation very quickly. And, you know, if the instrument we use doesn't indicate a clear motivation, that's not a bad thing. What it means is that it's not what you think it is. It's not that the child's being a brat. It's not that the child was denied something they wanted. It wasn't necessarily escape from a work demand. So, you know, we call those kids, you know, that they're defying gravity. So if the kid's defying gravity, we know something else is going on. We need to look in different spaces, figure out why. So that's really critical. Now, you're a veteran yourself. And how do you approach treating veterans? Whether they have PTSD or not. We have two veterans working two American military veterans and one foreign military veteran working in the practice. And I have a strong specialization in police psychology, which is similar. And a lot of police are in the reserves and the such and do bounce between the military and the respective departments. But Shalonda Williams and her treatment of veterans, her main approach is that when they leave the military, the community is gone. This very built-in community with these great rituals, structure, support, all of a sudden is gone. So she has to teach them to rebuild community. What's your approach? What do you think is key with working with veterans?
It's actually changed for me, Dave, over the years. I got into mental health, wanting to help veterans such as myself, but have only really had a few veterans. I realized that going through classes like trauma and PTSD were my most difficult classes, where I was having to re-experience the most traumatic moments in my life.
Are you a combat veteran?
Yeah. Mm-hmm. And so, like, understanding anniversaries and stuff like that, I realized as a clinician, this stuff is re-traumatizing. And so I really make sure I pick my veteran clients carefully, because I don't want to use a counseling space as a space for me, but as a place for the client.
So what does an ideal veteran client look like to you?
Someone that's willing. I think that motivation, why'd you come see me today? I'm just curious. We're used to having labels put on us, PTSD. No one actually gives us an assessment. They just diagnose us with PTSD when they learn we're a veteran. And so normalizing experiences, that's what I try and do. I think the power of the Me Too goes a long way. And so I know what helped me was someone just letting me talk and listen. And when I felt like someone actively listened to me, it helped me immensely, because I had all these emotions pent up and they were just coming out. I didn't know how to stop them. I didn't know what's going on. I didn't know what I didn't know. And so when someone used informative confidentiality, this is a safe space. What you say isn't going anywhere. It allowed me to trust them enough to tell them stuff I couldn't tell anyone else.
So is that so? An ideal veteran patient for you is someone who has trauma, or
No, I think just is willing to come in here. A lot of veterans don't do counseling.
right?
If they do, they terminate real early. So finding someone to walk with them through this process is difficult. I think it's really on them. I provide the space, but I'm curious why they present.
It's you bring up a good point that they're very quick to put a PTSD label on this. That many moons ago, the Georgia Association of Chiefs of Police commissioned me to do a training for them on veterans returning to local police departments. That back then, 20% of all deployed military were worked in law enforcement. And as the wars were winding down, people were coming home. These police chiefs, what do we do with these veterans when they come back? And because the rules of engagement are very different in Iraq than they are in Duluth, Georgia, to say the least. So one thing I made clear in the training, and then I contributed to a book on police ethics. I said, just because someone comes back and they're hyper aware, and it doesn't mean they have PTSD. It's a transition phase. That's not what we define as PTSD. There are certain specific requirements. And PTSD has become, for too long, as someone who's been around a long time like me, that for a long time, no one knew how to identify it. Now we probably have too many people too quick to diagnose it, I think, too.
Yeah. That would be my take on it, is just, these labels are thrown out, but I think there's a time standard for PTSD and acute stress disorder, and there's a difference. And so I think a lot of this is maybe misdiagnosis. So that's what I think I bring to the table with veteran patients, is just that I've been through, we both been through this. It normalizes their process for them. And it helps me to ask the right questions. Like, what MOS were you? Sometimes I have patients that are experiencing symptoms of TBI and PTSD, but they never served in combat. But asking that question allows me to discover that they served in the artillery and they did training where they got TBI from shooting off howitzers.
Sure.
And no one's asked them that before. So they were surprised. And I think that's what I bring to the table with veterans.
I had a patient who was a cook in the Army, and he figured these things wouldn't really affect him, but he was in a forward operating position, and an artillery shell landed next to the mess tent, and he was right in that line of fire. Then, a lot of veterans will say it's not PTSD, it's an absence of PTSD, that they come back to civilian life and they can't get out of that battle mindset. And where do they go to get that becomes a bigger question, and searching for that cortisol hit can lead to other problems. I've done work with various veterans organizations, but the best one I've ever seen is Team Rubicon. That Team Rubicon trains these veterans to be disaster responders, usually in the form of natural disasters. And there's no shortage of natural disasters at this point. And, the skills you learn in the military aren't just about being lethal. They're about getting organized, delivering needed goods to needed people, overcoming barriers. So Team Rubicon is one of the best therapies I've ever seen for PTSD in veterans, because they deploy, they organize like in the military, and they're helping a lot of people. And I don't think we're going to see a decline in natural disasters anytime soon.
No, I would agree.
Talk about some of the particular dynamics of practicing in Carrollton.
As far as what?
Well, Carrollton, when we went there, there weren't a lot of resources, and there still are not a lot of resources. That it's part of Metro Atlanta, but there's not easy highway access there. And the community just didn't have a lot of choices at times. That's why we wanted to bring water to the desert. But no matter where you practice, you see certain idiosyncrasies of where you are. Like, I have another office in Atlanta. My Atlanta clients usually present with different issues than my Marietta clients. So what are you, and I know you've pretty much only practiced in the area. I think you were in Peachtree City for a while.
Yes. So again, I came into this field, Dave, thinking I was going to do veterans, and have been pleasantly surprised on just how wrong that initial thought was, because I see everyone here.
You're the therapist in the community, and you've had great reviews from your work with kids. The parents are raving about you, and the local psychiatrists rave about you too.
Thank you. Yeah, I think what surprises me the most is just how many kids out here have grown up without a parent.
Really?
Whether that's through divorce, death, just, yeah.
Every
trauma.
time I'm out there to co-pilot with you, we had a lot of grandparents bringing in their grandkids, raising
Yes.
kids.
My wife's an educator out here, and that's one thing that surprised me about one of the clusters she worked at, was the statistics on how many kids were homeless and living in hotels or temporary transitionary housing, and then how many kids were raised by grandparents. And it was almost 90%.
Wow, really?
For that one cluster, and just how different some clusters are. So you have that, I guess maybe dichotomy is the wrong word, but just a total difference.
It seems in Carrollton, from the time I've spent there, it's been hard to establish kind of a solid middle class there. It seems, is what I've noticed. It's a very loving community. It's a very nurturing community. They've welcomed us with open arms. They've been incredibly gracious to us. But there's certain particular challenges no matter where you practice. Okay. Talk about, you have several different certifications. Talk about them briefly. I know you have many, but which ones are the most useful? Which ones do you use most in your practice?
I don't use, I'm certified in war trauma and acute stress management through the American Academy of Experts on Traumatic Stress, where I'm an active member. And I'd say I use the certification in acute stress management every day.
Okay.
Just because I do triage based on how clients may present. I get maybe some clients that may be feeling suicidal. So that certification, that master's degree I have in crisis response and counseling is really, I use that daily. I don't really use the war trauma one all that much. There hasn't been very many clients that present with that. I'm surprised.
We've been out of active war for I don't know how many years now. I mean, the last batch of combat soldiers came out of Afghanistan 3 years ago, I guess.
Yeah.
Right. So it's not the issue it once was when we had two wars going on at once. You have a huge following of patients who are neurodiverse, who swear. So what's your magic sauce with them?
Trying to assess behavior, motivation, and then realizing the parent-child dynamic with it all, the family, what systems the child has around them that can make them more productive and successful.
Right. That's one reason we've never adopted at Triad the BCBA model, which is Board Certified Behavior Analyst. That we instead embraced an advanced practice model that I feel behavior analysis can be taught, especially to someone who has an advanced practice degree like you and me. And the issue with the BCBA is they're not really trained to look at family systems, other psychological symptoms, social symptoms. So we can do behavior therapy as needed, but we want to look at other dynamics in the family, social, self-esteem, possibly depression and anxiety as well. Sure.
And I'd just add to that, humbly, that I'm surprised one of the certifications I have is through the Stella, as a Stella mental health advocate. And that's just a process that where like it's a shot to the neck that calms down that fight or flight response that we get.
Right.
And yeah, so it's referring that patients out or clients out to places in Georgia that do that.
Okay. Very good. And what closing thoughts would you like to leave us with if someone's considering you to be their therapist? What would you tell them?
Ooh, that therapy is a process, and to just give it time. And when you come to our office at Triad, it's a safe place.
Very safe.
Yeah, very safe. And you'll be listened to, and you won't be judged. The clinicians there are humans just like you, and we just welcome the opportunity to try and assist you.
Absolutely. Thank you so much. I appreciate you saying this. And to those of you out there in YouTube land, we hope you liked the video. Please leave comments, like and subscribe to our channel if you feel the inclination to do so. Thank you so much.
Yeah, thanks for having me.
Anytime.